Okay, my name is Kortne Shauntee, and I will be going over the process of a therapy session. Initially, both the social worker as well as the client will introduce themselves. The opening introduction from the social worker will just consist of course, their name and that type of information, their credentials, maybe some past job experience, and maybe a bit of their reasoning for their career choice or where they are right now. The client will also introduce themselves, their name, who referenced them to that particular social worker, and maybe just a little background. The social worker may then go over some relationship building conversation tactics, maybe an icebreaker. This just helps build that bond, build a relationship for the process moving forward. As they continue that conversation, the social worker will be listening to identify the need for therapy. Based on the introduction, the social worker should be actively listening to that client's background, their upbringing, any personal opinions that may have been stated, their strength, their weaknesses, what they like to do, what they don't enjoy, their current employment status, and any other important information that may want to be shared. The social worker should also, if needed, ask open ended questions just to encourage the conversation. Um, they can also just, use that skill of restating that question. So if they say they recently just lost your job and they're struggling to pay their rent, just restating that. So you say you just lost your job and you're struggling to pay rent, and then the client will respond, assuring that the social worker is correct, and they can go on from that point. During this time, the social worker will open the discussion, also speaking, taking notes. These notes can consist of any information that the social worker feels that is important to the therapy session, that will play a part in moving forward in the treatment plan, the assessment, diagnosis, things of that sort. As a social worker, it is very important not to overtalk your client. You can let them know that you care by providing nonverbal cues. This is like nodding or facial expressions showing concern. As the conversation develops, the social worker may begin to give verbal cues. It just depends on the information that has been provided. As the social worker moves forward and prepares for therapy, excuse me, this is where you will get more of the assessment and diagnosis stage. As the social worker, they will go over all their notes taken and develop a plan for the client based on the current challenges, needs, and personal strengths and weakness already stated. This is before the initial back and forth therapy session. So this is just information that has been provided from the relationship bonding and just open conversation, identifying why they are there, their needs, and what they expect outcome from this session. Once this plan has been completed, the social worker and client will have their first therapy session. This particular session was based off of just not having a job, rent is due, they need food, things of that nature. During the therapy session, they will hold both the social worker as well as the client will hold nothing back, using all skill practices to ensure an effective therapy session. The client will speak about their challenges they are facing, as well as goals and things that they may already have in place. The job of the social worker is to help them reach the goals that they desire. With the information provided, the plan may be revised, but we will still look over it together and set a goal for the follow up session. In this case, the client has told us that they are out of job, like I had already mentioned before, and they're struggling to pay their rent. They also mentioned that inflation is food prices, being a single mom with a daughter, is a challenge. However, during the initial meet, the social worker did take note during that icebreaker that the client stated that she was good at doing hair. So the social worker may mention, um, bring that back up. This can be a great bonding tactic, as well as a money opportunity for the client that they may not have already tapped into or started to do. Ending this therapy session with the information collected, the social worker will present the treatment plan to the client, as well as giving them follow up goals. This can be big or small, depending on the strengths or challenges the client is currently facing. So, this can be the social worker telling the client that she wants her to revise her resume by the follow-up session, or maybe she would like for her to go apply to maybe 3 jobs and send her over that follow-up application material. Just steps and skills to ensure that the clients can get the ball rolling. If the client shows symptoms of maybe depression or other health disabilities, then maybe the social worker will refer them to maybe another client that can handle that medical part of that diagnosis. With the intervention and problem solving, using the plan to think of obstacles that may present themselves while trying to implement plan and skills. Obstacles that may have presented themselves before therapy, and goals and skills. So this may consist of just anxieties of things or turn downs in the past that may have that client feeling like they do not want to move forward, and the social worker will provide them with tactics to overcome those things. Um, During the follow up session, the social worker will look over the things that the client has completed or has not completed, what obstacles they may have faced during completing these things. But I feel personally the most important thing during this follow up session is to ensure that the client is comfortable, and that that relationship that you started to build um, has developed a bit more. So to ensure this, as the social worker, maybe switching up the environment, maybe meet up at a coffee shop, or if you have your own office where you practice, maybe providing refreshments or snacks, something that maybe the client would enjoy. And this, just like I said before, just ensures that that relationship is there, so that if and when the client needs to come back or they face new challenges, know that you care and that they have someone that they can go to, and that social work client relationship has already been formed. And as we know, as adults, life is life and it's always happening. So to know that you have a good social worker and somebody that you know provides resources, they are trustworthy with the information and challenges that you share with them, and you know that the outcome is going to be positive, that helps ensure good client social work practices. Thank you for listening and enjoy your day.